that better? Okay. All right. So we're going to talk about a upcoming exercise that's going to occur over 2017 and 2018. Um, my goal today with this presentation is hopefully convey that this exercise really is an opportunity for our healthcare partners um, to not only collaborate with community partners, but maybe fulfill some of those CMS requirements that Travis was so eloquently talking about earlier, but also just build regional capabilities. So what I plan to do is kind of paint a picture of how we're planning to roll this exercise out. I'll give you a little bit of background on where this exercise comes from and how we chose to do or how the structure of the exercise came about, and then we'll talk about the exercise itself, what's being proposed, and how it will be deployed throughout the region. Okay, so first off, our friends at HHS and the friends at ASPR, the Assistant Secretary for Preparedness and Response, have been pushing healthcare coalitions to do exercises over the past 5 years and beyond. So, but this year, what they've done is kind of created a canned exercise and made it a requirement that we perform this exercise with our healthcare coalition and its partners. Then, out of the CMS emergency preparedness rule, healthcare facilities have their exercise training and exercise requirements, so this will help fulfill some of those requirements. And then looking at our disaster medical coordination center plan, we've been doing I just started. They have been doing a lot of work over the past 15 months to update that regional plan and define roles and responsibilities for the DMCCs within the region. And part of those are conduct annual trainings and exercises with community partners. And then if we look at the 2017 Region 9 Healthcare Coalition Training Needs Assessment Survey, we had a high interest in emergency management planning, communications planning, and medical surge planning. With this exercise, we're looking at doing an evacuation exercise, which is also a point of interest for our coalition. I believe with an evacuation exercise, we should be able to touch on the aspects of emergency management, communications, and medical surge. So, all right. So, just to cover the exercise real quickly, the first part of it is really an evacuation exercise. It's a low notice tabletop exercise with functional elements. I know I'm using a lot of exercise terminology, so if you have questions about what I'm talking about, please feel free to ask. But really what we're trying to exercise is our evacuation protocols for acute care hospitals or acute care healthcare facilities. The low notice aspect of the exercise is something that's new. Normally we let people know or let the participants know of an exercise well in advance, and we know the exact date, the exact time. But what is being proposed is that we identify a 2-week window that the exercise may occur in or will occur in. And then within that 2-week window, we would send out a message to the participating agencies and say, the exercise is today. You have 1 hour to activate your hospital incident command team or command team. And then once you get in the room, you would take a current bed census and figure out how to evacuate your facility within 4 hours. Now, the idea for this exercise is to be challenged. We think that it's more valuable to have a challenging exercise and work through things as challenging as they are than it would be to do a easy exercise and everybody come out meeting the low-hanging fruit of the exercise. So it's set up to be very challenging in that aspect. Now there is no like if we don't evacuate the appropriate amount of people within the allotted time frame, there is no repercussions or anything. We're just setting a timeline or a metric to base our assessments off of. So it's just acts as a starting point. So what we need to do is place patients in other healthcare facilities. So the tabletop aspect of it is the healthcare facility getting their incident command team together and discussing how to do that. The functional aspect would be reaching out to other healthcare facilities, actually calling them and saying, if we were to evacuate today, could you help us? Could we place our patients there? The other aspect is that is transportation. We need to reach out to transportation resources and see if they would be able to assist us in transporting our patients to those receiving facilities. So those are the functional aspects of it. The other part of the exercise is a situational awareness. Travis has also talked about the Essential Elements of Information tool, or EEI tool. We plan to exercise that process. Recently, it's been updated from its previous form. It was sent out originally in a Word document as an attachment in an email. We've tried to simplify that. Again, Hannah has simplified that process and made it an electronic form that you can receive via text or in an email and punch in your information and hit submit. It's supposed to be very easy now. So we're going to test that process. And really, it's supposed to be able to give a situational assessment of our region and share it with the appropriate partner. So we're going to test that piece. Plans we're looking at testing. Really, we're going to be looking at the Region 9 Disaster Medical Coordination Center plan and that Essential Elements of Information tool. Now, this is what's being proposed. Once we go out and establish planning teams or exercise planning teams, they may have internal plans and procedures that they want to exercise too. And we can incorporate those into the exercise as needed, as long as it fits in within the scope of the exercise. And we'll also be touching on the state disaster plan. It all kind of feeds into each other a little bit. So proposed objectives, they're pretty simple at this point. So basically, the objectives are to exercise that Region 9 DMCC plan, to coordinate patient placement during an evacuation, and the next one is to demonstrate an ability to use that situational awareness tool and distribute essential elements of information to our community partners. So participants that we're targeting for this exercise are primarily going to be hospitals. They're key in that evacuation piece. We're really looking at acute care healthcare facilities. Obviously, the Region 9 Healthcare Coalition, and then EMS and emergency management. Those are key players in the exercise. But other potential participants are going to be public health and other healthcare organizations, like skilled nursing facilities or long-term care facilities. Those types of organizations may participate only in the essential elements of information part of the exercise, the situational awareness. So we decided to roll the exercise out at a sub-regional level. Rather than create one giant exercise to test our entire region, which is somewhat unrealistic, and there may be a lot of artificialities in doing that, we decided to break it up into 3 sub-regions. So we're going to be doing 3 separate exercises over 2017 and stuff. The first one is scheduled for the 2-week window of October 16th through the 27th. And that's going to be for the northern sub-region of Region 9, which covers Ferry County, Stephen County, and Fond du Lac County. The next one is targeted for February 5th through the 16th, and those dates are more tentative. We'll narrow those down once we talk to planning teams as we get closer to the exercise. And that's for the southern region, southern sub-region. The next exercise will be in the 2-week window of May 1st through the 11th, 2018, and that's going to be the central exercise. So another reason why we looked at a sub-regional exercise model was because it follows our DMCC plan. We have 3 sub-regional DMCCs identified for Region 9. Holy Family covers the northern region. if I can get the Holy Family covers the northern region, uh, Coleman Regional covers the southern region, and Deaconess covers the central region. So we're exercising those DMCCs one at a time. And we're really looking at testing that plan to see if that sub-regional model actually works. After we do these exercises, we're going to get our planning team, our strategy exercise planning strategy team together and see, did we exercise that plan efficiently? Does the plan need to be changed to reflect a better process? Or do we need to tweak how we're doing these exercises in order to better evaluate those plans? So my role in this will be to coordinate all the planning efforts at the sub-regional and regional level. I'll also ensure that all the exercise documentation is complete. So if you have requirements within your facility or CMS requirements to provide documentation, you should be able to use all the information from this exercise. Now, we are asking for participation in the planning leading up to it. It shouldn't be just the name on the list and you get credit for the exercise. We're really looking at building partnerships and relationships throughout the region. We've also established a strategy team, which we've met, and we've identified a strategic direction for the exercise, and that's what I'm talking about today. Their goals are to set the strategic direction of the exercise, reassess the exercise planning strategy after each exercise, and identify regional plans to the exercise. And really what we're looking at in general with that group is to align regional preparedness initiatives with the exercise planning strategy. So the DMCC plan has already been in the process. They're looking at testing it. That lines up with what we're trying to do within the exercise. So we're trying not to duplicate efforts anywhere. Okay, and then the sub-regional exercise planning teams. These are teams that I will reach out to and try to establish once we move into the planning phases of this exercise. So the northern sub-region is going to be first up on the list. I will be reaching out to hospitals and emergency managers and whoever else needs to be on that planning team really quickly within the next few days to put together a planning team to set up our first planning team. And they'll be responsible for setting sub-regional exercise objectives, which could incorporate facility-specific objectives or county-specific objectives or what have you. And then also they'll address exercise support and logistics. So here's our timeline. So this is our strategic planning team. We meet before and after each exercise. I'll be reaching out to the northern sub-regional planning team to establish or to set a date for our initial planning meeting in the next few days. What I've done is I've set up basically a 4-month time frame for us to plan and conduct an exercise. We'll have an initial planning meeting, a midterm planning meeting, and a final planning meeting, and then an exercise. The next month we'll follow up with an after-action report or a draft after-action report to collect feedback on, and then we'll finalize it. Within the time frame, I've also allotted time to conduct training or drills. These are build-up activities to ensure that we provide our players in the exercise with the tools they need to be successful. So if that's a training in WATRAC, we can help facilitate that training. If it's an internal training that is more of internal focus, that's something that you decide you want to do, we can support that and we can talk about that later on. But really it's just designed right here to say there needs to be build-up activity. People need to know how to participate and how to play in their role in the exercise. We'll be testing the essential elements of information tool in the coming months. So that will be counted as one of these drills as a build-up drill for the exercise. So once the first exercise is conducted, that same month, this is how it's planned out. I've planned it anyway. We'll start planning the next exercise, and I'll be going around to these regions and setting up planning meetings on those in those areas. So more convenient for these people, and I'll be traveling to make it more convenient to attend those meetings. So again, initial planning meeting, midterm planning meeting, final planning meeting, conduct exercise, draft after action, and final after action report. Training drills are built into the timeline, and then again, for the last region, central region, we will hopefully after each exercise we'll refine the planning process and hopefully, and if possible, update plans. That's a short time frame for updating plans, but certainly we'll refine our exercise plan process. Does anybody have any questions on the timeline? Yeah. Good question. So it'll be done by November. So this is the original time frame. I think I said on the last slide it will be done in the last 2 weeks of October, actually. So good point of clarification. Thank you. Okay. All right. So just to summarize, this exercise will help you fulfill some of your CMS emergency preparedness rule exercise requirements. So it's a great opportunity. Yes. Yes. Great question. That's where that essential elements of information process comes in. So it won't count as your full-scale exercise, but it can count as your community-based exercise. So if you're signed up to do or participate in the essential elements of information process before the first exercise at the end of October, that should meet that requirement for you. So I'll have some instructions to point you to how you get involved in that EEI process, and there's also a form in the back with instructions on how to get involved in that.
The other thing I'd offer, and I can't remember if we talked about it at the last Healthcare Coalition meeting, I think we did, but this is very close. It won't align, but the Great Shakeout, which is the annual earthquake exercise coming up, is a very easy exercise to align with, and for any organization to kind of plan around if they don't have another opportunity to meet that community or facility-based exercise requirement. And we can talk some more certainly about that. Casey can probably elaborate a little bit, but just want to make that connection.
Earthquakes didn't come up as a threat on our hazard vulnerability assessment from where we live, and our exercises have to be based on our hazard vulnerability assessment, as I understand it, and they have to be done by November. So even the Great Shakeout, I was hoping that actually we were going to maybe tweak it, because I would imagine it wouldn't show up on most people's as very high. It certainly, it was extremely low. We only felt like we might have to respond if there was an earthquake on the other side of the state, but we didn't actually. Of course, we had one a couple weeks ago, but nobody got hurt was our point too. So we didn't feel we could use a Great Shakeout, to be honest. So I'm really hoping, and I'm also home health, so we actually aren't even a part of the one that's being proposed right now. So, and there's several of us home health providers here in the room, so I don't know our part in that at all. So something like the Great Shakeout, but maybe that could apply to home health and could be done by November, which I recognize is a very short timeline, but that's kind of what I was hoping for.
Well, and Casey, would I be correct in saying, I mean, we're talking about regional implementation for the exercise, which means in the North Counties, the hospital is going to evacuate the second week of October, and those patients are going to have to be distributed out someplace. Those patients can be distributed out outside of that region. So you're a home health agency, and part of your role in that exercise, as we're looking at the essential elements of information tool, is we're going to send out the need for information. You can respond back to that information if you're part of that process, and you can say, you know, we have the capability to provide home health for patients that can be transported home. And so there are ways to connect you into that exercise in a in a more limited manner that would still give you credit for participating in that exercise, that I think we can probably work in there fairly easily. You know, you're not going to be taking patients as like the hospitals are, but through the other components of the exercise, there might be some simple things that we can add in there that allow some of these other organizations, even if it's just information sharing, to acknowledge back that we can provide this service or we can do this, just to make that connection through a communications process gets you involved in that exercise. Is that a fair statement?
Yeah, yeah, exactly. It's really, this is the initial proposal. These will be finely tuned as we bring them to the sub-regional level. So if there's an element in there that you want to exercise, bring it to the table. As long as we stay within the scope of the exercise, what's being proposed, we have a lot of potential to fulfill, you know, what you're proposing. Okay. All right, and then the next thing, there's going to be 3 exercises between October and May. Plans that we're testing are the DMCC plan right now, and the essential elements of information tool. Specific exercise dates will be defined at the sub-regional level. So once I establish those planning teams, the planning team will know the exact date of the exercise. What the intent is that their facilities and their coworkers will not. So it's kind of privileged information to be on that exercise planning team as far as exercise goes. So to participate in the exercise, I will be reaching out to hospitals because they're the main focus area of the evacuation team. If you would like to participate in the EEI process or participate in any way, the first step is to sign up and get registered in our EEI process. So you'll need to go to the SRHC /HCC website and click on I'll follow these instructions on here. You don't have to read it. There's also a form in the back, so if you need more information, please grab that form. It looks like this. This is also on the website. You can find it. It'll give you all the information that you need to do. Here's my contact information. Please ask any questions you have leading up to this. We want to be as collaborative as possible. If you can't get a hold of me, Travis is a good contact too. Other than that, that's the exercise for the coming year. Are there any more questions? Okay, thank you.
Thanks, Casey.